Evelyn, thank you very much. We turn now to a difficult but timely topic. September is Suicide Prevention Month, and this afternoon we're learning ways to check in with loved ones, especially children and teens. According to the American Foundation for Suicide Prevention, it was the second leading cause of death for people ages 10 to 34 in 2023, so just wrap your head around that. A concerning development in the rise of AI. Multiple families in the United States are suing AI platforms for the role they claim the technology played in the deaths of their teenage children. CBS News reports the mother of 16-year-old Adam Rain, who died by suicide in April of this year, testified before Congress OpenAI's ChatGPT became a, quote, suicide coach, end quote, for her son. OpenAI has pledged to roll out new safeguards to protect teens, including parental controls. We are so happy to have licensed clinical social worker Shani Butler here with us today. Thank you for taking the time to be here.
Thank you for having me.
I'm just curious, what goes through your mind whenever I was just reading that?
Heartbroken. I mean, it's really, really tragic, but I think that just goes to show why suicide prevention work is so important, because we want people to be educated and understand how to talk to people that are feeling suicidal so that they're met with compassion instead of fear, so that they're more comfortable to reach out.
And what are you hearing from your profession on the use of AI in therapy?
Well, I mean, there's definitely some good places for it. It has some great benefits, but I think when it comes, to, maybe these type of topics with like suicide prevention, there's some other alternatives that we can turn to, because it's understandable, especially with our youth, why they might be reaching out to this type of a platform like AI, because they grew up in the digital age, right? So,
yeah.
And also we know that some people have a really hard time reaching out that are feeling suicidal, right? That's really hard because they're afraid of what others might think, maybe that they're a burden. So we already kind of know that. So, but we do have other alternatives like 988, their 24/7 hotline. They also have text and chat, and they're trained in suicide prevention and how to talk to people that are feeling suicidal. Even if you were to dispatch like a mobile crisis worker that we have at Community Counseling Center, we have a virtual option too.
And how can we show up for people who are maybe feeling suicidal, especially for the parents? I can remember as a teenager, I had a few friends who unfortunately were suicidal, and the one thing that they said is that they didn't want to be a burden to their parents with their issues. How can you show up for your children?
Absolutely. That's where the education comes into play, because we need to be able to identify what the warning signs are so that they don't necessarily have to be like, hey, I'm feeling suicidal, right? Because that might be difficult for them. So if we can identify like, hey, your behavior seems a little different, hey, I'm worried about you. Are you thinking about suicide? And being more direct about that and just showing that we care, it's going to make all the difference. That's how you really make a difference and save a life.
And why is this month so specifically important to you guys?
Because of Suicide Prevention Month, we really want to show the community what that impact looks like, and again, encouraging those to educate themselves and be a part of this movement. We have a lot of different things to promote Suicide Prevention Month. We have our ribbon campaign that we do that really shows the impact of suicide. We have these little reflective pinwheels. We have them posted at all of our 5 counties, and they're the purple and teal, which is the Suicide Prevention Month colors, and that signifies an actual loss of a loved one that we've suffered to suicide. So when you see those, you really see the impact in our local communities that suicide has.
How big is it here?
I mean, I think it's still fairly big. I mean, when we talk about rural areas, if you don't feel like you have as much access to resources and stuff like that, that's when you can see the numbers. But when you have more training in suicide prevention, there's actually research that shows that the suicides decrease. So like with QPR, which is Question, Persuade, Refer, which is a training that we can offer at Community Counseling Center, you do see those areas that are very heavily QPR trained, just like CPR, if that's how they did that. The suicides do decrease. So that would be a really great thing to have.
Well, we appreciate you taking the time to be here and sharing your knowledge with all of us, Shani. Thank you.
Absolutely. You're welcome. Thank you.